Introducing the Aleutian Spacer System from K2M, surgeon-driven design. The patient should be positioned as appropriate for a posterior approach, taking care to preserve or improve sagittal alignment of the spine. After the pedicle pathway has been prepared and proper pedicle screw length and diameter have been determined, the appropriate implant is selected and loaded for screw insertion using the threaded screw inserter. Using a combination of surgical instruments appropriately selected by the surgeon, a laminotomy, laminectomy, and/or facetectomy is performed, along with the removal of the ligament flavum to gain access to the disc space and identify neural and bony anatomy. Once all screws have been inserted, the rod size is selected or cut to the appropriate length for the construct. At the surgeon's discretion, a lamina spreader or K2M distractor may be used to open up more space for access to the disc. Using any combination of nerve retractors, the cauda equina and nerve are mobilized to expose the annulus of the disc. Using a scalpel, an incision is made to the annulus of the disc, and the discectomy is performed as needed using appropriate surgical instruments. The system incorporates various curettes, including cup, rake, and ring shapes. The connector shaft screws into the proximal end of the handle, engaging the curette, which fits into the distal end of the handle. These curettes are available to aid in the removal of appropriate bony material and/or initial removal of cartilaginous end plate at the discretion of the surgeon. Disc spreaders are available in corresponding heights to the implants. The proximal end of the spreader slides into the distal tip of the long T-handle. A spreader may be inserted into the space as a temporary spacer while contralateral preparation is performed. Appropriately sized shavers are available for gross removal of the cartilaginous end plate. As with the disc spreaders, the proximal end of the shaver slides into the distal tip of the fixed T-handle. Disc shavers may be used to help repair and decorticate the vertebral end plates. Morselized bone graft and/or a combination of osteobiologics may be placed in the anterior portion of the vertebral body. Implant trials are included to aid in initial test, fitting, and size confirmation of the implant. The appropriate size spacer is chosen at the discretion of the surgeon, based on the trial height. The surgeon or staff may utilize the bone packing mold to aid in placement of the appropriate bone graft and/or osteobiologic. The packing tap may be used as final prep of the bone graft material in the implant. A mallet and/or slap hammer may be used to aid in implant placement. The proximal end of the implant is loaded onto the tangs of the straight inserter. The thumb wheel is lightly pushed forward while turning in a clockwise direction to engage the threaded retaining shaft into the implant. With appropriate neural element retraction, the implant is introduced into the space. The implant may be disengaged by turning the thumb wheel of the inserter in a counterclockwise direction. X-ray or fluoroscopy may be used, live or periodically, to verify placement. Compression may be achieved using a compressor found in the Denali spinal system. After appropriate compression is accomplished, provisional tightening of the ATR set screw should occur, followed by application of the anti-torque alignment tube with anti-torque handle, taking care not to exceed maximum torque recommendations as marked on the torque wrench. The Aleutian Spacer System from K2M, surgeon-driven design.